Well, hello, everyone. My name is Ryan Huff, and I'm the Communications Director for the Denver campus. And I also serve as co-chair of the Links Together Communications Committee, and I will be moderating today's discussion. Thank you very much for joining us as we talk about the June soft return to campus. We know you have a lot of questions, and we hope to provide a lot of answers. And to do that, we have a great panel assembled today. That panel includes Chris Puckett, the Managing Associate University Counsel and co-chair of the Links Together Task Force, Pamela Jansma, the Dean of the College of Liberal Arts and Sciences and co-chair of the Links Together Task Force, Elena Jones, Interim Vice Provost and Senior Vice Chancellor of Student Success, Doug Cassion, Human Resources Director of Employee Relations and Performance, and finally, Dr. John Samut, a pulmonary physician and epidemiologist. He's also the Dean of the Colorado School of Public Health. And behind the scenes, we have a team answering your questions in the Q&A function. And if you have a question during this discussion, please enter it there. We have Lauren Galleri, she's the HR Director at the Business School, Taylor Broderick, the Marketing Manager and co-chair of the Links Together Communications Committee, Claire Hamilton, Senior Ecom Specialist, and Kelly Mason, the Assistant Director for University Events. So at this point, I will turn it over to Pam for some opening words.
Good afternoon, everyone. Thank you for being here on this nice, warm, soon not to be so warm day, as is typical of Denver. I just want to let everyone know and reassure everyone that the safety, health, well-being of our campus community, our staff, our faculty, and students is of the utmost importance to all of us, and to all of this as we engage in this soft return. The key is flexibility and inclusivity. Not all of us have flourished in the remote environment, and we need to think about the learning environment for our students. Just a brief summary on Links Together. This has been going on for a number of weeks now, and we have 8 task forces that are working on various aspects of safe return, including one for staff return and one for faculty return. So all of the recommendations that are being put forward for this soft return come from those working groups. And with the vaccines going well and the availability increasing, we thought having an approach that involved a soft return in June with a long runway before classes start would be the most important thing. And we also want to remember why we are returning. There's a preference among students and faculty for in-person learning. But in saying that, we want to keep equity in mind and to serve all of our students. And we know that for some, remote has been challenging. And our mission is also, as a research university, and faculty need to get back to labs and the research environment. Units will decide what is best for them, and we will do this all in conjunction with whatever the public health guidelines are from the state and the city and what we determine to be best. So thank you for joining us.
Thank you very much, Pam. Chris, go ahead.
This is the second time we've done this. We did it with supervisors last week. And so I want to thank you for joining us. For those of you who are joining us again, and those of you who are joining us for the first time, I want to start with a thank you to all of you for doing your jobs in an amazing year, amazingly, meaning we know that you have gone above and beyond in your jobs, faculty and staff, and I think students too, to do what you need to do. And for that, I am eternally thankful. I'm one of these people who don't create value. I don't teach people. I don't, create research. I serve you folks, and I am glad to be able to do that. And I'm honored to be able to do that. But I know that this year has been difficult, and I know that you all have sacrificed. And I know it's been a year of loss for many of us. And it's going to be difficult to a certain extent to come back. It's going to be different. And that's part of why we want, with the Links Together Task Force, to provide opportunities for people to give feedback, to engage, to come up with a runway that makes sense for the business units, meaning we're not going to drive centrally a specific number of days that you have to return. There's not going to be a specific number of hours that people have to work. The goal is for the business units, the schools and colleges, to identify for themselves how to provide the services that they need to their constituents and focus on that, making the students' needs go first. And from there, we develop and create what it is we need to do. A couple thoughts when we get into this. I think one of the things I've learned over the last year with COVID is we have to stick to our principles. And that means on everything. And Pam said it, safety is first. And so we are going to do everything in accord with the public health guidelines. And frankly, there may be things we do that go beyond public health guidelines, depending on where they end up, as Dr. Samut's going to talk about here in a minute, about where the future holds for us. I just say that to say that there may be some things that the university does a little differently than the city, than Denver Public Health does. And we're going to take the steps that we feel like we need to in coordination with public health and other experts in to continue to provide safely for our community. I think one thing I do want to mention from the top, we are working closely with AHAC in this space or area. Was on a call this morning with them, identifying cleaning protocols of all things. But I know folks get worried that Auraria is not at the table. What I can tell you is they're absolutely at the table with us, and we're trying to create together some guidelines and principles so that we can all open safely as we need to. I think one last thing, I'll just mention a quick story. I told this on Thursday, but I was reminded a couple weeks ago, we hosted an equity clinic, an equity vaccine clinic on campus, where we were honored enough to be able to host 1,100 vaccines for folks in BIPOC communities. And what fascinated me and I really enjoyed was the return of our student volunteers. And the student volunteers were just amazing. And I think there are times when in my job, and I know others who don't necessarily have student-facing jobs, forget how incredible and amazing our students are. But what it also reminded me is how much these students, even though they don't know who I am, they don't know what my job is, they want connection and they want engagement. And sometimes they just want a direction. Sometimes they just want a friendly face. And I think we have to keep that in mind as we move forward, that all of us have a role in that, in providing an open environment and welcoming environment for our students. And I think it's a reminder to me that there are students who desperately need and want that connection. And we all can help provide that, whether that be remote or in person as we move forward. So thanks, Ryan. Thanks everybody for being here.
All right, thank you very much, Chris. Dr. Samut, I'll call on you next. And just for everyone's background, Dr. Samut has worked very closely with CDPHE over the last year with the governor's office, and it's a real delight to have you join our panel. I'll just ask you first, what is the current state of COVID in Colorado as it relates to infections and spread?
Great, and thanks. It's nice to be here with you. So I think everybody knows the pandemic has had its ups and downs in Colorado. We're in the fourth up right now, and I think its explanation lies in the variant, the B.1.1.7, that is now the dominant strain. It lies in changes in measures. I think it lies in COVID fatigue and people not doing what they should be all of the time. So we have about 600 people in the hospital across the state today with COVID-19. About 3 weeks ago, that number was around 280. Of course, with our December peak, it was over 1,800. So in that sense, we're doing okay, but we're on and up. In the end, vaccination is going to push the curve down. It certainly pushed it down among older people. We have far fewer people 65 plus in the hospital right now than 40 to 69. So looking out to June, the summer, the time when we're all going to make transitions, I'm hopeful that by then this sort of race, if you will, between vaccine pushing the curve down and everything else pushing the curve up will have been overwhelmingly won by vaccination.
Well, thank you very much. We will certainly have a number of more medical questions for you here later in the panel. But next, I'd like to turn it to Chris and Pam. So it's the first week of June, getting ready to come back to work. What does my first day look like from, maybe getting to campus and then getting to my office? And what things do I need to do now aside from maybe update my wardrobe?
Update your wardrobe. Thank you, Ryan. I resemble that remark and have about 3 pairs of pants that fit me now instead of about 12. So I am helpful. I'm glad to be coming back to campus because it's inevitably going to keep me from eating, I hope. So what I would say is this, I know there are lots of questions about transportation, and so we're going to talk a little bit about that. But one of the things we announced on Tuesday is that we are going to be providing free parking on this side of Spear underneath the CU Denver building and the business school for at least the months of June and July, recognizing that folks may need a little bit of transition time. I think once you come to campus, what I would say is we're not going to have our check-in stations. I would say at the moment, we are still under a public health order from Denver that requires us to do daily attestations. My thought is that perhaps, and I hope this is true, that perhaps by June we won't be doing daily attestations. But at the same time, our expectations would be the same, which is if you're sick, you don't feel good, you stay home. If I've learned anything from this pandemic, it's that. If I'm sick, I need to stay home and stay away. At the same time, I think what you'll also see is we're not going to have like indoors and outdoors. We're not going to have necessarily spots on the floor where you're supposed to stand 6 feet away from each other. Although depending on where we are in the pandemic, that still may be required, but we aren't necessarily going to space out everything. What that also means is, our hope is that as we return plans come together and the business units put them together, that they have put meaningful thought into how can they schedule and or space people out if we need to continue to do spacing, and or if we aren't doing spacing, how we can still operate in our space. So I would say on behalf of our OIT team, the first couple weeks may be rough if your computer is still at work. There's been some concern that even the motherboards may have cracked over the last year. So I would just say, take it easy when we get in the first couple weeks. I would say you feel free to go out to lunch, bring your lunch. We're going to have, we're working on trying to identify spaces outside and inside that people might be able to eat lunch, or eat at your desk, which I know Pam and I both are big fans of. So hopefully that answers some of the questions, Ryan.
Yes, thank you. Let's talk about RTD for a moment. We know for the months of May and June, there are EcoPass options available, $23 a month, and you can sign up now for those. But July 1st and beyond, tell us what that might look like.
So July 1st and beyond, CFO Todd Haggerty and the area leaders are working literally every day to negotiate with RTD to identify the EcoPass. It's not quite EcoPass, but a monthly pass that we'll have available to us, both our staff and faculty and students, by the beginning of the fall semester. So they are diligently working hard on that. We anticipate being able to have something in place. Exactly what that looks like and how much it costs, I can't tell you. What I can tell you is that we are, our staff return team, which Lauren Galleri, who's on here, and Danielle Bruner are in charge of, are working and reaching out to RTD to talk with them about what the steps they're taking to make sure that people are safe on board. The electrostatic cleaning, the air exchanges on the buses, the limitations currently on the number of people on buses. So suffice it to say, what we are doing is you will see over the next few weeks an opportunity to engage with RTD or next month or so to have some question and answer about what they're doing currently and as they move forward.
Pam, what does this summer look like for faculty? And then as we approach the fall, what will it look like for teaching classes and doing research?
So we're going to try and get as back to normal as we can for the fall. Faculty for the summer, faculty are on 9-month contracts, and so they are not under contract during the summer. So most of the time faculty are not around unless they are teaching or doing their research and scholarly activities on campus. And we imagine that that will continue. The Return to Research Task Force has been working on guidelines, which are pretty much ready, and we're looking forward to having people back in the labs doing field work and having students involved. In terms of the fall, we're advocating being as normal as we can, the next normal or the new normal, however you want to define it. But however that is, it will always be within the guidelines, the public health guidelines that we have. And no one will be forced to feel unsafe. As I said earlier, safety is paramount.
This next question, maybe I can start with Chris and then move to Dr. Samut. For the summer months, will masks be required? What about social distancing? And then I'll turn to Dr. Samut just for maybe predictions for the months ahead on those.
I would say we still don't know. I mean, I think what we had promised is we weren't going to change anything through the end of the semester. So that means kind of we're not going to change the masking. We're not going to change the attestation process or the check-in process till the end of the semester. As far as where we go in the summer, I think it's still up in the air. I think Dr. Samut and others, Fauci, might say that masking in different areas may be with us for a while. I would just say that leadership continues to have that conversation, and it's still too early to be able to tell what distancing wise and masking is going to fall out for the summer. So stay tuned.
And Dr. Samut, if you have a crystal ball for the months ahead, do you think masks indoors or outdoors will still be required by the counties and state? And what about social distancing?
Right. So, I mean, even today, of course, CDC and the Biden administration are talking about relaxations on masks for those who are vaccinated and outdoors. I think maybe an important point about masks. Why do we wear them? Well, two reasons. One is source control, we being the source, and particularly keeping us from spraying out the larger droplets that are infectious. Those are the ones that, are supposed to stay within roughly the 6-foot bound. And then some reduction of small aerosols. And then we wear them to protect ourselves. If we are vaccinated, there's a low likelihood that we are going to be carrying the virus and potentially transmitting it. I think we will be maintaining masks for a while indoors because it's an important norm, and particularly in public places where we can't count on everyone being vaccinated. Masks will remain an important form of source control. So I think across the summer, we're likely to see mask mandates for indoor spaces, and probably perhaps a relaxation for outdoor spaces, particularly following on these latest recommendations. And I do hope that there's some seasonality to the SARS-CoV-2 virus, and we will perhaps with summertime warmth and changes in humidity, we'll see a further drop in the epidemic.
Thank you. Elena, next question for you. How should work units create their plans for the quote unquote next normal?
Thanks, Ryan. The first thing I'll mention is that the Links Together return team is working on a return to campus planning tool, which will be available on the Links Together website. So thank you very much to the work of that team. But in advance of receiving that tool, I do encourage everyone to start having conversations among your teams or departments. The priorities for us to consider are, as has been stated numerous times, the safety and health of our community, focusing on the student-centered approach, learning from and integrating our positive disruptions from this past year, and committing to an equitable approach. So let's talk a little bit about what that looks like. My recommendation is that every unit starts this planning process by talking as a group about your unit's work, that you talk about it from the perspective of the groups you engage, serve, and support, that you think through each of the services you provide, the activities you perform, the groups you support, the hours that best serve the needs of the groups that you engage, and the modalities of engagement that work best for each area of responsibility within your unit. The safety protocols must be a priority, and we know that these protocols will adapt and change as more and more of our population in the CU Denver community are immunized. Those safety protocols become a part of your operations plan, which means that your plan will adapt and change over time as the protocols change. So as you think through all of these variables as a unit, a projected plan for operation should start to emerge that will inform those hours of operation and the modalities of operation for various activities of your unit. The next step is to take that operations plan and work through a fair and equitable approach to staffing that plan. For some units, this process might be done primarily through group conversations. For other units, you as staff may need to speak with your supervisor and have individual conversations about your specific situation, and that each faculty and staff member talk with their supervisor about their specific constraints. So the intent is that by June, we are starting to build our on-campus presence towards that operation and staffing plan that we have created for your unit. We live in a time of uncertainty, so I really want to emphasize that this is a plan based upon the current projections and the best information you have available to you at this time. So we need to be prepared to observe how things are going, revise what isn't working, revise according to the latest safety protocols, respond to the feedback from our students, and adapt as the fall semester progresses.
Thank you. There's a lot of parents who work as employees. Some of the summer camp options are not available this year that have been in the past. A question we had at our last session, will the Health and Wellness Center consider any kind of summer day camps to help out?
Yeah, thanks, Ryan. Yeah, that's a really great question that came up on Thursday. And it's a really interesting idea that we're exploring, but we don't have an answer on that yet. However, I do want to set expectations for everyone now that if the camps are to go forward, they would not be a replacement for a full childcare for the summer and would likely require payment. But this is all in the process of being assessed right now.
Great, thank you. Doug, I have some HR questions kind of along the same lines on childcare and working parents. What are the expectations for parents, just say for the month of June, showing up who have difficulty securing childcare?
I'd say work with us. We certainly understand that the pandemic has an ongoing impact on what may be available for childcare and elder care. And if that does become an issue, then please work with us to identify alternatives and possible arrangements that could be made to help somebody both address the need at home and the need at work.
How about a hybrid work schedule? What are the requirements one must meet in order to go through with a hybrid work schedule?
Well, there's currently a process in place for alternative work arrangements, and that would involve identifying the issue that you need to take care of personally and allow us to interface with the department with regard to their needs as well. So we're looking to work with everybody on these issues.
Thank you. So we have a number of questions coming through. A lot of them relate to vaccines and whether those will be mandatory. Chris, for at least today, what can you tell us about that?
Well, thank you to Scott and others who sent me the press release from the governor when he said, I support all the institutions making it mandatory. So that's what the governor has indicated. I think what I have said for a while now has been, I think the vaccines are going to be, in many ways, our way out of this, vaccines and testing. And I think that in part of what you're seeing with Governor Polis here, I would say it's just a matter of time and perhaps a few other things before you see many places requiring the vaccine in their workforce and from their students. So I would just say, stay tuned. I think we have conversations about this literally on a daily basis. And so there are lots of people who are engaged with this. I think one of the things that we have talked about, and Kelly Mason, who I'll give a shout out here too on the call, has been amazing over the last year. And one of the things she and I talked about today was we need to be cautious that people who aren't vaccinated don't become stigmatized and don't become ostracized in a way. I think what's really important for us, especially as we move forward, is to recognize that there are many different reasons why people do what they do. Having said that, somebody else asked on a question and answer, are we going to be able to determine or evaluate how many people in our community have been vaccinated? Well, we actually might. We actually have a couple different entrees and to be able to perhaps get a sense for the vaccine uptake in our community. And we're actually working on those as we speak. There are a couple different ways we might be able to do that. But I would just say stay tuned. And I think what you'll see won't be a surprise when it happens. Having said that, there's a lot of time between here and the fall that a lot of things still have to be worked out. That's why we have such a long runway, meaning the answers we give today could change in 30 seconds because that's how these things go. So stay tuned, and we'll try and continue to keep you updated through meetings like this, as well as our weekly newsletters.
Thank you, Chris. We'll stick on the vaccination topic. I have a few questions for Dr. Samut. Can a fully vaccinated person become infected with COVID And if so, can they transmit it to others who are not vaccinated?
So 2 comments. So, I mean, these vaccines are terrific. 90% efficacy is not 100% efficacy. So some people who are vaccinated are becoming infected and can become ill, although it appears the vaccines provide great protection against, more severe disease and dying. But that amounts to a few percent potentially, which is what we would expect with this kind of vaccine efficacy. It seems that for those who are fully vaccinated, I mean, in general, the likelihood of being infected, carrying the virus, and transmitting it to others is very, very low.
Thank you. Just a few situational questions we all might find ourselves in here in a month or so. So let's say I'm riding in an elevator, I'm wearing a mask. Another person is wearing a mask and they start coughing. Let's say they have COVID. Could transmission occur in that situation, or how likely would it be?
Well, I guess I'll take that one as from me. And brief exposures have been shown to be infectious. And again, a mask is potentially 40, 50+% effective against larger droplets. So it is conceivable that a brief encounter could lead to an infectious event. That said, again, low probability, and guidelines around time relate to the fact that the more time you're in space with someone who's infectious, the greater the likelihood. But the kind of situation you described, where so-called spray transmission could take place on the elevator if there were not sufficient distancing, say the 6 feet, then there's the possibility of transmission. Not zero, but not high.
Oh, thank you. Another one, Dr. Samut. A lot of people will be potentially eating lunch at their desk. We probably won't all be in the break room around a table like we used to be. So if somebody removes their mask and is eating lunch and other people are walking by, are there transmission concerns in those situations?
Well, again, I mean, I think as we talk about these future scenarios, I think it again depends on, how prevalent vaccination is, of course, and I just spoke to that. I mean, I think in an unvaccinated world, hopefully that person eating the sandwich unmasked is distanced from others at that 6-foot margin. I mean, I remember, I think that 6 feet is particularly important for these larger particles and less effective, not completely effective, for the smaller aerosols. Again, we do all we can. We can't prevent every single encounter that might lead to infection, and I mean, this is where the role of vaccination is so critical.
And just last medical question for a moment. We know some people have been vaccinated for 5 months or so. Are their vaccines still good? Do we have any predictions on how long a vaccine will last, or will we need booster shots at some point?
Right. We're certainly going to learn how long vaccination will last. And, I think everyone is operating on the assumption that there will be protection for at least a year. These RNA viruses like SARS-CoV-2 mutate. I mean, we're always now talking about the variants. So far, by and large, the variants, certainly the variants circulating here, are responsive to the current vaccines. So I think over time, assuming that this coronavirus remains with us, which it seems like it will, we will probably looking to have boosters just as we do with influenza, anticipating the strain changes that will happen over time as the virus mutates.
Oh, thank you. We have a number of questions in the chat, so I'll start asking some of those. Pam, I'll send this one to you. For faculty who are teaching in person during Maymester, what is the best source to find guidelines, or what are the rules for them? Is it similar to what we've been doing thus far?
Yes, I would say for Maymester, which is coming up here pretty quickly, hard to believe it's almost May, that the rules will be pretty much what we are doing now. So keep that in mind, but the guidelines can change daily. So when we have new information, we will provide you with new information.
All right. Anyone can take this one. Does CU Denver have a plan for what employees who are parents will do if public schools go remote during potential outbreaks, say if that were to occur this summer?
that is a great question. And that is a question that we're asking our Links Together team, staff return team, to come up with some ideas and proposals on, because we do recognize, and I've got 2 kids, dirt monkeys at home, who are, you know, ready to be out of school, but who are, you know, if things go remote, we're all going to have a conversation. So suffice to say, I think the team is going to put some ideas together. And so we will be getting more information out about ways that we might be able to support and think about that as we move forward.
Chris, this next question in the chat sounds like a lawyer question, so I'm going to send it to you. The faculty and staff want to know, are they allowed to ask students, have you been vaccinated? And then if they have not, can they ask them to wear masks?
It's an interesting one. I think the mask wearing, I'll start with. If we have a mask requirement in place, we'll do what we did last summer, right? Which is, yeah, mask wearing is a requirement. And if somebody is not wearing a mask in a space they should be, then they can absolutely be asked to put it on. And in fact, we have a great resource, and I found it again, Elena, the team from last summer, that put together on how to have those hard conversations, which is really what it's about. So we'll make sure and find that link and put it out there as well. As far as asking about vaccine status at the moment, I'm not sure why somebody would be asking that, other than currently if someone wants to just get a sense for what students are thinking or feeling. I think that has the potential to cause some fear, so I'd be concerned about that. I think what my preference would be is for someone to tell the story about why they're getting the vaccine, or why they are comfortable, what made them make the decision to get the vaccine. I think sharing that information from a faculty member makes a lot of sense. I think once you start going down the path of you're vaccinated or not in a classroom, I think it gets really complicated. And so I think you shouldn't be asking that question. If and when we do require the vaccine, that information would be centrally kept, and we would be clear and transparent about how we would handle that. So, and that's all assuming we get there. But at the moment, that's what my answer would be is, yeah, it's not something we want you to be asking folks, but I do encourage you to share the story about why it is that you've chosen to do it, because you never know if that's going to influence somebody to make the decision.
And a great chance to plug, if people are looking for ways to get vaccinated, we have a clinic right here on campus, the 5th Street Garage. In fact, we have vaccinations occurring through 5 o'clock today, and also a pretty good availability on Thursday from 8 a.m. to 5 p.m. at the 5th Street Garage. So I know one of my colleagues will probably put up a link for that on how you can sign up, but it's quick, it's easy, it's free. So you have many options there. The Ball Arena just across the street also allows walk up or drive up. You don't even need an appointment. And of course, your healthcare provider and many other pharmacies are offering as well. So no shortages of places to get it if you'd like to get it. And we certainly encourage you to do that. So we have a question in the chat about elevators. Who cleans them and how frequently?
That's a great question. And I don't know the answer, but I can guarantee you we will get it for you and respond. I know that we talked to our Space Force, which is what we call our kind of facilities team. And I know that elevators are high on the list for providing information. I think some of the other things I saw, air exchanges, air quality, those kinds of situations. Watch the website and watch the FAQs, because we're going to be putting out information soon about what we're doing in buildings, what we're going to be doing in spaces, and kind of the status of how the elevators will be handled, and the air exchanges that are going on in there. And I'll just mention just briefly, one of the things we are doing in a few spaces right now, and we're looking to potentially expand it, is there's some research coming out of Boulder from Jose Luis Jimenez about using CO2 in MIT as well, some CO2 proxies for how the virus may react in certain spaces. So we're actually looking at trying that with a number of our spaces to see if there are some spaces on our campus that maybe have better air exchanges within a space versus others. So I would just say we hear you. There is lots of concern about air exchange and air spaces. Our Space Force is working on it, and we will have more information on our website, so pay attention to it and the FAQs.
Dr. Samut, maybe you can speak to this. Obviously, the cleaning of the elevators would refer to touch surfaces. How common is transmission person to person versus, say, if you touch an elevator button and then you, I don't know, touch your mouth or something like that?
Yeah, we've certainly learned a lot across the course of this pandemic. And I think, at the start, I think we all remember when touching a doorknob without immediately cleansing your hands seemed like you might be sentencing yourself to COVID-19. I think fomite transmission, so-called surface transmission, has proved to be far less important than anticipated. The controversy early on was about these larger particles, droplets, versus the smaller ones, aerosols, which do travel. And I think right now we really settled on the aerosols as being important in transmission, which if you go to a small space like an elevator, then that does become important to distance and as Chris alluded to making sure that there's good air exchange. The idea of carbon dioxide is we produce it, and if we're not ventilating enough, the concentration builds up. So an elevated CO2 concentration is an indicator that we're probably not bringing in enough fresh air generally from outside. On the other hand, an elevator, the doors open and close, they have high ceilings, and I'm not sure I've seen any data on likelihood of transmission, but it doesn't seem like the most probable scary location. There are plenty of others.
Oh, thank you. Doug, we have a question in the chat on when will the revised policy for the alternative work schedules and remote work arrangements be available for staff to review?
Yes, thanks, Ryan. Yeah, this is an important development in that and this will help expound on my previous answer on the hybrid work arrangements. There's a policy that's been reviewed and approved by the chancellors that will be effective this September. And there's a process associated with remote work in that it'll be initiated by the school college department human resources business partner at the request of the supervisor, and involve the head of that operating unit, whether it's a dean or vice chancellor, so that the process will flow in an electronic form from that HR business partner to the head of the unit for approval, and that will then kind of document that arrangement. So that's going to be hand in hand with, actually that'll be ahead of the policy being effective, but the policy just codifies where the decision making lies, and that will be in the school, college, and unit. We will have access to data that will then identify where are our people. Are they, in the Denver metro area? Are they working, outside of the Denver metro area, interstate, international? Because we need to keep tabs on these for a variety of reasons. Tax purposes just being one of them.
Let's keep it with you, Doug. There's another question in the chat on in recent messaging, we've said that we do not believe many employees will be fully remote going forward on a long-term basis. So the question is, does this mean that office units have authority to permit certain staff to remain fully remote going forward after considering safety, best service to stakeholders, modalities, equity, et cetera?
Yes. To this point, our office has been involved in approving all of those kinds of arrangements that was suspended during the past year because it would have been impossible to process that much paperwork, documentation. But as we come back, yes, there'll be a process that allows us to document those arrangements as well as understand the data behind it.
Earlier, Chris alluded to being on campus recently and some positive interactions with students. And I just want to ask Elena, in general, why are we returning in person? What are the benefits, mental health benefits, or any others to being with one another?
Yeah, everyone has done a really excellent job in this remote environment. And I really have the deepest gratitude for everyone's flexibility, diligence, and adherence to safety. We also know the pandemic's mental health impact has been significant, and isolation has prevented some opportunities to foster the profound learning experience that are a hallmark of higher education. So really what we're looking to do is optimize the campus experience, and that's an equity issue for us. We know that the pandemic has disproportionately affected low income and underrepresented communities across work and wage loss, health impacts, and bigger disruptions to their education. So without that increase in in-person classes, this equity gap will continue to widen. And as our students return in greater numbers for an on-campus experience, it's really important that we too are engaging with our community in person. Again, like I said before, this is going to look different than it was in the past. As Dean Jansma said, we're looking to our next normal and what that next phase looks like for us. But it's really important that we incorporate an in-campus experience so that we can really, truly build the higher education experience that our students are looking for.
Some people have asked about travel for research, for conferences and such. What is the state for this summer and then more long-term as we get into the broader academic year?
So the travel suspension that was put in place across the University of Colorado, all 4 campuses and system office, that was put in place on March 12th of 2020, and that is still in place. However, there is the possibility to appeal and receive approval for travel. For domestic travel, it must be approved by the dean or vice chancellor if it's in an administrative unit. For international travel, it must also, so in addition to the dean and vice chancellor, it must also be approved by the provost. But please be advised that the Department of State is now adopting some of the CDC methodology for risk ratings. And at this time, 80% of the countries worldwide are designated by the Department of State at a risk rating of 4, which is do not travel. For your personal travel, the CDC advises that people who are fully vaccinated with an FDA authorized vaccine can travel safely within the United States. So keep those different considerations in mind.
Thank you. We've had a question in the chat on if this session will be recorded and posted somewhere. Yes, it will be. I would hope in the next day or two, we'll have it on the Links Together website. So for anyone who missed this or wants to watch it again, it will be available there. I think this next question could probably be answered either by Pam or Elena, and it is relating to in-person events. If programming offices want to start organizing student events this summer in person, do we need to get prior approval for that?
How about I jump in on this one?
Sure.
Kelly Mason, who's in the background, will be telling me exactly what to say. But at the moment, we will be putting up some guidelines for what's expected over the summer. I would say at the moment, if you're looking at holding something big and massive in the summer, then yeah, we're going to want to talk about it. But our goal is to get some guidelines up so that we can, as folks, as appropriately, right, identify ways to get together. That's one of the things that our student life team is working on. This very issue is trying to come up with some ways, creative ideas for people to get together outside. So she says, hold off until after July 1st. Okay, thank you, Kelly. We will hold off until after July 1st. But the goal being, the student life team is putting together ideas about how we can do this safely and effectively as they move forward. And events@ucdenver.edu is the email if you want to reach out and ask questions, if you do have something in June or if you want to start planning something in July. But our goal is not to have a central approval situation for significantly very long, if at all, this summer.
Dr. Samut, we have a question in the chat. Can you speak to the efficacy of natural immunity for a person who has had COVID versus someone who's vaccinated, and if those are considered differently for any reason?
Well, I will say in our modeling, we've actually not considered them differently. What we have done, and again, this is based on available evidence, for those who have been infected and are asymptomatic. So these are people, and there are lots of them, and typically at younger ages, that immunity is waning. For those who were symptomatic when they had COVID-19, the data would suggest that natural immunity may last about a year. And right now, I mean, we don't have a basis to say whether the efficacy of the protection afforded by vaccination, that afforded by naturally acquired immunity, would differ. They may well last about the same length of time. At least that's what we're projecting. But certainly we'll learn more about this over the next year.
We talked a little bit about RTD earlier, but another question in the chat just on how safe it is to ride the bus, to ride the light rail. I know RTD has required masks. I believe that'll continue for a while, but maybe some are wearing them, some are not. How safe is the train or the bus?
Is that for John?
Dr. Samut, yes.
I was hoping it was for somebody else, but you know, I will say, obviously, RTD is concerned about this. Early on in the pandemic, I was on a mobility task force, in fact, for Denver, and we discussed a lot of these issues in cleaning protocols. Clearly, the safest is to observe on public transport the same rules that we are following in general, which would be masking and distancing. And you know, I don't know what the air exchange rates are and, you know, the various forms of public transport. I suspect they're reasonably high. And, you know, again, the best way for protection is vaccination. And after that, wearing a mask. But, you know, there have been a few well-documented episodes. Early on, there was an episode of transmission of bus in China that was looked at very carefully for the circulation and who became ill. But you know, we're beyond that now. People are wearing masks. More and more people will be vaccinated. So I guess the answer is I don't know, but things are clearly going to go in the direction of being safer and safer.
You know, RTD's website has said that their filters and such circulate the air just under 1 minute. There's new air coming through each time. So next question just could be for anyone. Has the equity of the faculty and staff been considered, which could include individuals who are doing very well in a remote or hybrid environment who feel now they're forced to head back into the office?
I'll jump into that one. I think that this is part of the reason we're asking supervisors, vice chancellor, deans, and chairs to have these conversations now and start having them as we move forward. I think what we're avoiding, and I know I saw somebody's question, are we required to provide student service between 8 and 5? I don't know. You know, I think that's going to be a conversation amongst your units. I think being able to provide some kind of service during some period of time is absolutely critical. But we're avoiding having, you know, folks like me here who say you have to be on campus 3 days a week, 5 days a week, whatever it is. The goal really is to focus on what are the services we need to provide. And our hope is that through that, our supervisors will be able to evaluate and consider, okay, where have things been successful? What has been successful? And I think there really is, and I think this was clear from the beginning. Do we think there are going to be tons of fully remote people? I would say not right away, probably not. But the truth is that this next academic year for CU Denver is really trying to establish what the next normal is. And it may be different from where it starts to where it ends next spring. Meaning we already know that somewhere between 50 to 60% of our classes are on campus or hybrid, right? That means there's 28, 29% that are online. That's an increase. So what we're seeing is we are seeing different behavior from our students. And so I would anticipate that there will be certain units that have conversations about how those different needs and interests are met outside of what traditionally we have done. And so that might mean different times. That might mean different modalities. That might mean doing it differently. Absolutely. I think the conversation that I think is important to have is the human connection one. And I think we've all tried to talk a little bit about that has incredible value for our students and for each other. But yeah, our hope is that those equity conversations can be had and that they are going to be had, and that if need be, HR and others can step in when they need to. We are going to have, just as far as resources go, we've got some toolkits, we're going to have some templates, we're going to have personal resources, we're going to have training, we're going to have all these things available for supervisors to help support you folks as staff and faculty in making these plans. So please know that that's not the focus of this call, but it is something that we absolutely are putting together, and Lauren and Danielle and her team and others are doing that as we speak to try and provide some of those assistance and guidelines and principles for helping people return.
So I'll just jump in for a second and say that The other thing is that we don't have all the answers. And so this is going to be a little bit of a pilot or a trial and error, and we're going to work this all through the next year. So this is not all of a sudden the decisions are being made and we're not going to change them if they're not effective or if we see that we can do them in a better way. We all know things have worked. We've all been remote. So we know that things have worked. But it may be that there are certain times of the semester, right at the beginning, for example, where we need to have more people around for the students who are wandering and trying to figure out their way. So I think the key is to be flexible and to learn from what we did and to move forward with what worked.
We have about 8 minutes or so left. We'll do our best to answer the remaining questions. The next one, this could be for anyone. If an individual is fully vaccinated and travels internationally over the summer for personal reasons, will that person have to quarantine, say for 2 weeks or so before you come back to campus?
I don't think we plan on implementing quarantine protocols. Elena, you're with me too on that one. We did, I mean, just, you all know this, we did early on in February and March and that kind of weird time frame, but I don't anticipate us doing that unless CDC recommends something, or John, you recommend something. I think that's not one that we're going to jump into.
No, agree, Chris.
All right. Let's see what other questions we have here. So has the campus community been surveyed, or do you plan to have a survey for the fall? It seems like there's a lot of discussion on what is best for students, and have students been able to give that input?
We have done a number of different surveys, and I know there's continuing conversation about that as we speak, to try and gather more of that input about what students are most interested in. We did one at the end of last semester, and I think we've got some other things that are teed up. We also have, just as far as feedback goes, we have a number of staff feedback sessions that are coming up. Ryan, I don't know if we have a link to that, but that is, listening sessions are some of what we're trying to work on. We've been working closely with our student government team as well to try and identify what they're interested in, their concerns, what they're most interested in. I will take one question that I thought was interesting, and Pam, you may want to jump in too. For students who've struggled over this last year, what are we thinking about in helping students prepare for next year?
Yeah, so we've thought about that a lot. You can imagine in the College of Liberal Arts and Sciences, where we have a lot of the core and we have a lot of the courses for the first year students in math and science, where people really struggle. And we don't know what the learning environment was for a lot of our students. And remember, we have a full year of first-time students for us who've never been on campus really. So we've thought about this, and there are a number of things that are happening, including boot camps, and then also some co-curricular instruction and lots of other things that we're going to put into place over the summer and in the fall. And some things, to be honest, were not that obvious to me. So for example, for chemistry, they normally use students who've been in the labs as their TAs for the next year, but their students haven't been in the labs. And so there needs to be a special boot camp for that. So we are thinking about those things, and I'm really glad that you brought that up, because I want everybody to know that that's something that's at the very forefront.
We have a question in the chat on just the timing of coming back in June for 1 or 2 days a week. And the question is, why are we coming back in June when most courses are online over the summer, and when other CU campuses are returning more in the July, August timeframe?
I think our goal was to try and create a long enough runway for folks to be comfortable, recognizing that it's going to take some time. And I think I would just encourage those folks who think they'll be able to show up August 1 and be ready by August 14, that's tough. I'll just tell you, there's mental stuff, there's clothes you got to buy if you're me, there's other things that you got to do. But I think our goal was really to start having these conversations and engage with folks as much as possible. Does that mean that there'll be some units that don't do a lot of stuff on campus in June? Absolutely. My wife and I are taking a 2-week vacation in June. I would anticipate a lot of us will take vacations in June. So the goal was not necessarily to make it a hard and fast, thou shalt come back a certain number of days. The goal is to allow flexibility so that folks get comfortable over the summer, so that by the start of school in August, we're in the next normal and we're at some level of understanding what it is we think our students need and how we can serve each other best.
We have a couple of questions in the chat on school spirit, camaraderie. We all like that. And the questions are there resources available for rebuilding that teamwork and that sense of community. And specifically, is there budget available if units want to, say, do swag or have a welcome back event or initiative?
I'll tell you this, Lauren and Danielle, who are on our staff return team, who've done a lot of work in preparing documents, are very, very excited about this topic, about how do we create a welcoming environment for employees in particular. But then we have our student life team that's working with Elena and Kelly and others, and Sam Kim and Amber Long, on how do we do that for students. So yes, there may be money available. And there's lots of fun discussion about that. So stay tuned. If you can, sign up for one of the listening sessions and they'll help get you plugged in.
Well, we have a few minutes left. We had a number of questions asked, and thank you to our panelists off camera who have answered, I believe, about 70 or 80 of those. So thank you very much. I'd like to just go around the room for the panel here. Any final words or anything else that you wanted to include? And Chris, let's start with you.
I'll end where I started. Thank you very much for all you do for us, for our students, for our faculty and the staff, and for each other. I would say take time as we get into May and June. In all seriousness, take time to recharge, because what we're asking for, as Pam has said, is flexibility, and that's tough. It's gonna take energy. So thanks again for joining us, and thanks for everything you do.
Thank you, Chris. Pam, go ahead.
I just want to reiterate what Chris said. Thank you very much for everything that you do. And I want everyone to know that we understand that there is anxiety and there are differences in terms of how ready people are to come back. I'm going to say the same thing I said last week, which was that Dean Paul Teskey sent round to the deans this article in the New York Times about how a lot of us are languishing. And I took that very much to heart. And I'm looking forward to coming back and seeing people, but I also know that we have to have empathy and we have to move forward with flexibility. And that's what this is all about. And we'll do it together.
Thank you, Pam. Elena.
Thank you. It's truly been an unprecedented year plus that we have been going through. And so I add my thanks to all of you. This has not been easy by any stretch. And it's not going to be the easiest thing to come back. All change is a little bit challenging. So I want to thank all of you, because I know it takes resilience and it can be exhausting at times. And you've really shown up and really delivered for our students and our faculty and our staff and given each other grace. I'm really appreciative of that. The other thing I want to say is that, please do start having these conversations among your units. I'm seeing some questions. Well, what does that look like? What's specific? And asking some specific details. Really, this is for you and your units to sort out the best plan that's going to work for you, and then to talk to your leadership about that plan that you've come up with and to get their guidance and support. So if you're struggling with those conversations or you're running into roadblocks, I want you to know that we're available to you. All of us on this panel, we are available to help you have those conversations. And we support you and appreciate as you talk this through with your group.
Thank you, Elena. Doug, any final words?
Thank you. Yes, I just would also like to express my appreciation. Obviously, the future is getting brighter every day. It's certainly not without its challenges. I've been impressed with the grit and determination of the faculty and staff in the last year, and as one who has a tendency to be in the flow of those understanding those challenges, I would just like to say that campus leadership is here to help you work through them. So I certainly appreciate you all.
Thank you, Doug. And last but not least, Dr. Samut.
Well, I think we're in an extraordinary place when you think about where we started back last March. We have vaccines that work. We're talking about a return towards normalcy. And I think we're fortunate. Science has brought us here. I've talked about this a lot, the so-called light at the end of the tunnel analogy. Yep, there is. I think people are frustrated because the tunnel turns out to be a little bit longer than we want, but it's not a year longer. It's, now we're talking about a month or two. And I think it's time, as you are doing, to figure out how to get back as safely as possible to where we all want to be.
Great. Well, I want to thank all of our panelists for your time today. I also want to thank the audience. We had 300 plus people tune in, and we really appreciate your questions. And please know the Links Together website is a great resource for additional information going forward, as is the Thursday Links Together newsletter. So we will be providing more information in the weeks ahead. For now, thank you very much. We'll see you next time.